Tension headache. This is the most common type of headache in the world, and most people have felt one at some point without knowing exactly what it was. It usually feels like a dull, steady pressure wrapping around the head, often described as a tight band squeezing from both sides. Muscle tension in the neck, scalp, and shoulders is typically behind it, triggered by stress, poor posture, lack of sleep, or long hours staring at a screen. Unlike some other headaches, it doesn't usually throb and rarely gets worse with physical activity. Most people can work through it, though it makes everything feel heavier and harder. Migraine. This is far more than a bad headache. It's a neurological event that can completely disable a person for hours or even days. The pain is often intense, one-sided, and throbbing, and it frequently comes with nausea, vomiting, and an extreme sensitivity to light and sound. Many people with migraines experience what's called an aura beforehand, visual disturbances like flickering lights, blind spots, or zigzag lines that signal an attack is coming. The exact cause involves changes in brain chemistry and nerve activity, and triggers vary widely from person to person. Hormonal shifts, certain foods, weather changes, and even strong smells can set one off. Migraines run in families, and they affect women roughly 3 times more often than men. Cluster headache. Few headaches are as brutal as this one. Cluster headaches strike in cyclical patterns with intense burning or piercing pain usually centered behind or around one eye. They come in clusters, sometimes multiple times a day for weeks or months, before disappearing entirely for a period. During an attack, the affected eye may become red and watery, the eyelid may droop, and the nose on the same side may run or become blocked. Attacks are brief but ferocious, typically lasting between 15 minutes and 3 hours. The cause isn't fully understood, but the hypothalamus, the part of the brain that regulates the body clock, appears to play a role. This might explain why attacks often happen at the same time each day, with striking regularity. Sinus headache. This type develops when the sinuses, the air-filled cavities around the nose and eyes, become inflamed, usually from a cold, allergies, or a sinus infection. The pain tends to settle across the forehead, cheekbones, and the bridge of the nose, and it often worsens when bending forward or lying down. There's usually a feeling of fullness or pressure in the face alongside it. Worth noting is that true sinus headaches caused by infection are far less common than most people assume. Many headaches blamed on the sinuses are actually migraines, which can cause similar facial pressure and are often mistaken for a sinus problem. Hormone headache. These headaches are directly tied to fluctuations in estrogen levels, which is why they're experienced almost exclusively by women. They tend to appear in the days just before or during menstruation, when estrogen levels drop sharply. Pregnancy, the use of hormonal contraceptives, and menopause can all shift the frequency and intensity of these headaches too. For women who also experience migraines, hormonal changes are one of the most reliable triggers. The pain can feel similar to a tension headache or a full migraine depending on the person. Caffeine headache. When the body becomes accustomed to regular caffeine intake, it adjusts blood flow accordingly. Caffeine narrows blood vessels, and when it's suddenly absent, those vessels dilate again, and that shift can cause a throbbing headache, usually felt at the front of the head or behind the eyes. It often begins in the morning if a person hasn't had their usual coffee, or it can develop after someone deliberately cuts back on caffeine. The pain is typically resolved fairly quickly once caffeine is consumed, which also makes these headaches easy to identify. Exertion headache. Physical activity, sometimes intense, sometimes surprisingly mild, can bring on a headache that builds quickly during or right after exercise. Running, weightlifting, coughing, sneezing, or even sexual activity can trigger one. The pain is usually throbbing and felt on both sides of the head. It's thought to result from increased blood flow and pressure within the skull during strenuous effort. Most exertion headaches are harmless and short-lived, but because a sudden severe headache during exertion can occasionally signal something more serious, it's worth getting checked if they appear out of nowhere or feel unusually intense. Hypertension headache. High blood pressure doesn't usually cause headaches on its own, despite what many people believe. However, when blood pressure reaches dangerously high levels, a condition called a hypertensive crisis, it can produce a distinct headache that feels like a pulsating pressure at the back of the head, often worse in the morning. This type of headache is a warning sign, not something to wait out. It typically comes alongside other symptoms like vision changes, chest pain, or shortness of breath. Anyone experiencing this combination should seek medical attention promptly. Subscribe for more health and longevity videos. We will see you soon.